I think as a child, I always want to be a dentist. So therefore, this is actually my childhood dream. So people, I remember during the primary school days when we write essay, what would you want to be, right? So I write my ambitions to be a dentist.
Okay.
Yeah.
What kind of brace provided here?
Oh, we do a lot of braces here. Yeah, so I'm actually orthodontist by training. So what we do is that we do the standard metal bracket, okay, but over the years I found that the self-ligating technology is probably the best treatment. So therefore now we only use a self-ligating bracket system. For example, the Damon system, for example the Innovation, for example Lotus, they are all self-ligating system. And the advantage of self-ligating system is that they use very light force, and the treatment is faster, and the end result is a lot better. So we can correct very difficult problem still within 1.5 to 2 years. Yeah. And then nowadays we also use ceramic bracket because there's increasing demands that patients want to have more aesthetic treatment. Yeah, so therefore they want their braces to be invisible. So therefore we actually move from metal to ceramic brackets, and then ceramic bracket you still see wire, so patients still not quite happy. So now we move to invisible braces that we call it Invisalign.
Okay. How long you experience in this auto industry?
In orthodontic industry,
Yes.
well, I graduated from orthodontics as an orthodontist in the year of 1996 in London. So 96 until now is about 17 years.
Mm,
Uh, mm.
How do you become famous and build out your own name?
Uh, well, I'm not sure whether I'm really famous, but then what I do is that, right, every case, every patient that come to me, I always take pictures before and after, and also during the treatment. And at the end of treatment, I show it to the patient what is their progress, and then also we would always actively discuss with the patient about the treatment plan. I ensure that patient is very happy with the treatment. So as we do it every case like this one, then patient will understand that we are actually sincerely wanting to treat them to the best treatment result. I believe that's important. Maybe that's how I build it up, that we gain trust and respect from the patients.
Okay. So, what is your company's belief you're serving customers?
What is a company's belief in service a customer, right? But I think nowadays, right, is the era where it's no longer doctor center, it's actually a patient center era. So in the past, and when the doctor is there, doctor is always the greatest, a doctor is always right. But nowadays, right, is patient is always right, doctor is just a provider of service to the patient. So therefore our clinic's belief is that, right, is also patient is always right. We are very much patient center. We very much consultative with the patient, asking them what they want, and then we suggest treatment alternative and treatment plan for them. So my belief is that, right, is to make sure that every patient is happy, and our company's slogan is that, right, your smile is our concern. So therefore we really make sure that we create a beautiful smile for every single patient that come to us.
Okay.
Yeah.
So, does brace affect face and bone feature?
Yes, certainly it does, because orthodontic movement is actually involve moving the teeth within the bone, as well as affecting the gum and the supporting structures. So therefore when you move the teeth, the bone actually move also. So therefore it does affect the jawbone, and as the jawbone move, right, the soft tissue also follow. Yeah, so therefore when we move the teeth, people think that you just get the teeth straight, but to us we see the patient as in the teeth fitting onto the face. So therefore it's very important that when we move the teeth, we want to make sure that we still give a patient a beautiful smile that fit into their face, and that is very much different from what most other people will provide orthodontic treatment. So our philosophy is called face driven orthodontics. Yeah, the word face driven meaning that, right, our treatment philosophy center around how we can create a beautiful face at the end of the treatment, and then by positioning the teeth in the correct positions. Yeah.
Okay.
Yeah.
So how much is your price range for the bracelet?
Oh, our price range, the way we charge is very reasonable. In fact, some people even say that we are very cheap. Right. So now, for the self-ligating bracket system, let's say if using a metal one, for example, the Damon system, which is using stainless steel, it's only 7,500. All right. And then if they want to use a ceramic bracket, which is less visible, it's only 1,000 more, so that's 8,500. And then if they want something totally invisible, that we have the Invisalign, which is actually manufactured in California. That will be slightly pricey. That will be 16,000. But again, even when you hear 16,000, you say wow. But if you compare to many other clinics, as well as many countries around the world, we are probably one of the cheapest in the world, right?
Any special treatment that offer other than others dental clinic does not offer?
One of the things that we think that many other clinics, or maybe we're very proud of ourselves, is that, right, we very much focus on face driven as well as smile driven. So therefore, when we treat a patient, we look at the smile of the patient, we look at the face of the patient. We're not just a dentist, just do a teeth only by doing a filling, or just do make the teeth straight only. We are actually, we call ourselves as a smile design dentist, that we design a smile. We actually propose solution into how to make them look better and how to make their smile better. So this is something that I feel that I'm very proud of. Yeah. And then the other thing is that we have all the technology. For example, we use a lot of laser here. In fact, we have a few laser machines here, and the laser is actually the minimally invasive or the least invasive way of doing a surgery. So we are using our laser to do many things. For example, we can do some gum surgery, yeah, which usually does not involve bleeding. We can use the laser to do fillings also. We can use the laser to do what we call whitening, right? Okay, so there are so many things that laser can do, and therefore this is something that we feel that we're proud of, because not many clinics actually equip themselves with laser, but we already have a few here, and then we use it to the benefit of the patient. Yeah.
So why is it so important to keep our teeth healthy?
Oh, teeth is supposed to help us to eat, as well as help to speak properly, and more importantly is that teeth also give us a good smile. It support our face, therefore it gives us a self-confidence. So a person without teeth, or a person without a straight teeth, right, usually you find that they don't smile a lot, and therefore they have a self-esteem issue. So therefore I think it's very, very important for everybody to have a good set of teeth. Not only that they need to have a good set of teeth, but they also have a straight teeth, so that the teeth not only help them to eat, also help them to support the face, but also help them to speak properly, and more importantly give them a beautiful smile. Yeah, that will be long lasting, and that will be, I think, also one of the secret for success is to have a beautiful smile.
Okay.
Yeah.
Why doing brace so common and popular now?
Well, I think it's very much related to nowadays a lot of people wanted to improve their own self-esteem. Yeah, a lot of people also talk about personal grooming. So people are more conscious about their image. And teeth actually comprise about 40% of the whole facial structure. So the person without a good teeth, without a good smile, can never look beautiful. Therefore, that's the reason why I think so many people now are very concerned about that. They want not only their teeth to be straight, they want to have a good smile, and they also want to have white teeth also. So therefore, and we are here to be able to provide them all these solutions. We make their teeth straight, we make their teeth white, okay, and we make their teeth, right, fit into their face so that it smiles brilliantly.
Okay.
Yeah.
Other than ortho braces treatment, what is the other treat to make teeth look nice and presentable?
Well, yeah, they can consider, like, for example, crown and bridge work, alright, can consider things like implant, okay, yeah, that we can actually these are the alternative solution, or can consider veneers. All right, so these are all the other solutions that we help the patient, because sometimes they may not want orthodontics. All right, but nowadays we find that orthodontic is still the fundamental. All right, so we will offer, and if patient feel that they are a little bit resistant with the orthodontic, that's mainly is because they don't like the metal and the wire. Alright, so therefore Invisalign is a very good alternative for them, that they can wear the braces without anybody knowing that they are wearing it at all. Yeah, so that will be something that very exciting. I believe that many people's dream is that to do a invisible braces. Yeah.
What is your current concept
Current concept on?
on your business?
Oh, my current concept of business. Well, I actually feel that I like to share. I I like to teach. Yeah. So, and I like to actually be able to provide benefit to more people. Right. As Dr. Sanyat Singh, Sun Jong San has mentioned, being a doctor, you can only treat one person at any one time. Therefore, he chose to become a president to save the country. That he can say to so many people. But of course, I'm not as great as Dr. Sanya Singh. But what I also feel is that, right, with my limited skill and with my limited time available, I can only treat one patient at a time. So what I really like to do is to be able to set up a training center where I can share my knowledge with all my fellow doctors. I can actually set up a center of excellence where we will have a team of doctors to build a brand name for ourselves, and this brand name is called Imperial Dental Specialist Center, and this will be synonymous with a center of excellence. And we want to build this center of excellence so that when patients come to our center, they know that they are treated by good doctors and being provided with quality service, and then being actually getting a quality result of the treatment. Yeah, we are also thinking that this should not be just restricted to Malaysia. We also hope that we can be a center when we attract a lot of overseas patients to come, and that will also bring revenue to our country's economy. It also make our country proud as that we can export our healthcare to the rest of the world. Yeah, so this is actually my ambition. I wish that I will be able to share my knowledge, my skill with everybody, and I hope that this can also benefit more and more people in the world.
Okay.
Yeah.
So do you have any expansion?
Expansion.
Oh.
Well, it's, I actually started in the year 2002, October. That's the time when I returned from Singapore to Malaysia. Not many people from Singapore actually return to Malaysia. Yeah, I'm probably one of the very few. So we started off as one unit upstairs at this clinic here. Then now it's about 10 years later. Yeah, so we have actually built from one unit now to be 3 floors here, and we also bought over to the next shop lot here. So therefore, therefore in that sense we are expanding, right? So we also started from 2 dental chair to now we have 12 dental chairs. Yeah. So expansion is something that so that we have more facility to provide more services to our patients, so that we have more doctors to actually provide more treatment and service to the patients. But expansion is not so much in terms of making more money, it's more in terms of getting our belief to make it into a truly international brand name, so that people will, when they hear about our name, will associate that with quality and excellence.
Okay. So do you have any vision or mission?
Vision or mission? My vision is actually to make everyone have a beautiful smile. Right, okay. I feel that the world can become a better world if everybody smile to each other. Okay, so therefore, if people refrain from smiling because they have a bad teeth, right, may give other people a misconception that they are not friendly enough. But if I can make everybody smile beautifully, smile like a sunshine, that is actually something that I think I can contribute to the world to make it a better world. Right. And then as for my mission, I would say that my mission is very simple. I just hope to build a brand name, build a quality, a center of excellence, so that we will be able to, there will be more people joining me to make, to create a better smile to everybody. So my mission is actually to be a training and education center, to be a center of excellence, to actually be able to provide this dream to more people at large.
Okay. Can you share something history of your business?
History of my business.
Mm.
Well, I started in the year 2002 October. We only started as a very humble clinic upstairs over Jalan Telawi, and at that time I remember there were only about 6 or 7 clinics in this area here, but right now there are about 20 old clinics here, so therefore competition is very high here. But to me, I don't really look at competition. I just feel that I am someone who just love what I'm doing, so therefore it's my passion that carries me to work now. So in terms of the history, it's just that I'll say that I my passion helps me to provide more and more beautiful smile for the patient. As the demand actually increase, I therefore has to build more facility to help people. Yeah, so that is just my simple history of that. And of course, I guess everybody will get old one day, so therefore I hope that I will not be getting old so fast, so that I can continue to work hard and then to deliver my visions and my missions to people.
Okay.
Yeah.
May I know what is your current direction?
Current direction.
Yes.
Well, my current direction is very simple. I feel that one way that I need to do is to build a system for our clinic, and also to improve our customer service care to the patient, because being a doctor, what we can provide is only a treatment care, right? But then patient is still a customer if you look at it that way. So therefore we must also develop our customer service care, so that patients feel that they are not only treated by a good doctor, they also being treated very nicely by our staff team also. So I want to make them feel very much at home, right? So customer service is important. Then also another thing that I wanted to do is quality assurance care, meaning that we will want to have developed some questionnaire, some follow-up for the patient, so that we understand that patients are satisfied and happy with not just me, also my doctor as well as my whole team. So therefore my current direction is to develop a greater care and more personalized service for the patients.
Okay.
Yeah.
Last question.
Yes.
As we know, there is a special room for kids.
Yeah.
And what is the concept?
The concept is that, right, there are really quite a large demand for what we call pedodontist, which is a child dentist, to treat the young children. And young kids, usually they are very afraid of dentists. Yeah, so therefore we feel that what we require is actually a specialized room where we can have something designed more to the kids' favorite, and then we also must get dentists train them to be more patient with the children. Yeah, so therefore they are able to provide treatment to the children. And many clinics, when my experience with the parents is that when they brought their children to clinic for treatment, usually some of the doctor actually refuse treatment and say that maybe it's too young for treatment. But even a baby require dental care also. So therefore we feel that we should actually provide something so that develop in this area when there's actually a lot of demand, when many parents really want their children to be treated. So that's why we developed this special room for the kids.
Oh,
Yeah.
thank you.
Yeah, you're most welcome. So some people ask me, why do you name your treatment room as in like Sydney, Melbourne, or London, Paris, right? Well, I am very much international because I feel that this world is a global village. Yeah, so therefore those cities names that I put in, number one, they are related to me because they are the cities that I have been there, either as a student, study there, or attended conference there, right? Or have many patients actually coming from there. So they are all linked to me in one way or another, that I have certain sentimental attachment with those cities, right? And secondly is that if we want to truly reflect ourselves as an international identity, rather than calling our treatment room surgery 1, 2, 3, that's very common. Why don't we just name it as a city, right? And then in order to make it really synonymous to the city, right? For example, when we say Sydney, right, people will remember that it's a Sydney Opera House. So therefore, we select a nice picture of Sydney Opera House, and then we commission people just to make the wallpaper for that. Like for example, if you talk about Paris, we're thinking about Eiffel Tower, and London, we'll be thinking about London Cap as well as the Big Bang. So therefore, we will then get some pictures of this, then to put it in. So not only that it shows our international identity, it also shows that how meticulous we are in designing our room to give a special flavor, right? So I'm the person who likes to put things into details. So therefore, this reflects in my works in orthodontics or implant or any other treatment with my patient. I usually look into the details. So therefore, when I plan for my clinic, I also want people to see that I equally put details into my design, into my planning also. Yeah, so probably that's about it. Yeah.